Okay, so this is the second video lecture on the chapter of childbirth and the newborn. In the last lecture, we ended right around here, and I had just finished discussing, or just finished talking about the onset of childbirth. So this is considered like before you get to the first stage. Childbirth is, for our purposes, we're going to talk about it in these three different stages. So the onset is bloody show, right? Basically, it's before your contractions have officially started. The first stage is described as the onset of regular contractions, which, according to your textbooks and according to the medical community, would be about 5 minutes, right? When the contractions are about 5 minutes apart. There is a phenomena called Braxton Hicks, and this is, I'm not sure where that name comes from, but this is the idea that we have contractions that aren't full contractions because they aren't coming at a close enough period of time, or maybe they come. I think, what does it say? The Braxton Hicks contractions will disappear if you get up and walk around, and the real contractions don't disappear when you walk around. Also, in this period is a phenomena called when your water breaks. And basically what that is all of the fluid that's around in the amniotic sac. When the baby pushes down, it causes that bag to rupture. And so women will basically wet themselves, except it's not urine, right? It's fluid from the amniotic sac. And my understanding, I did not experience this with either of my children because I didn't go through the natural evolution of labor, but it's sort of like it's like, yeah, it's kind of like, I forgot what I was going to say, but it's a sudden, you don't feel it coming. Everything gets wet around your legs. And about 8 out of 10 women, pregnancies actually have this experience. You see a lot of this in the TV, in the dramatization of, oh, I guess I'm going into labor. And I think that one of the things our culture does is that we've been socialized to think this is something that happens to all women, and it just simply doesn't. And then you may be disappointed if it doesn't happen to you. This is considered the longest stage of the childbirth process, anywhere between 12 and 16 hours. The duration is longer for first pregnancies and shorter for second pregnancies. Labor can go on for 24 hours. Typically, like physicians, and I don't know the specifics here, but physicians will have different guidelines as to when they're going to stop and move into either emergency cesarean section or do something else. Like, how long is is a woman's body capable of laboring, going through these huge contractions? Okay, the second stage, this is a quiz question. It is in the second stage that the baby passes through the birth canal, right? Not the third stage. So that's a quiz question. This second stage is described as anywhere between 10 and 40 minutes. Obviously, the shorter is probably the better, right? This is a stage in which women may experience an episiotomy. Now, this is one of those medical procedures that I don't want to say it's controversial, but there is a philosophical camp that says that this is not a necessary thing. The episiotomy is the tissue between the vagina and the rectum, and it gets cut. And the idea is that the baby's head is too big to go through that space. So to avoid tearing of that tissue, they cut it. And the theory is that a cut heals more easily. So as soon as the baby comes out, they stitch it back up really fast. But the other camp, philosophical camp, is that with preparation, that the woman's body is designed for the baby to move through this. That, again, throughout human history, women have been giving birth, and if you prepare by stretching that tissue, say earlier months in pregnancy, there is no need to cut. And the idea being, I thought I had forgotten something here, and the idea being that this is a medical intervention that's unnecessary. It's damaging. The other argument is the cuts heal more easily than tears, and tears are out of control. So there's different philosophical attitudes about episiotomies. I would encourage you to be a consumer of medical information and to make a choice and to talk to your doctor. Okay, the third stage then, and again, before I started teaching this stuff, I didn't understand it this way. The third stage is the delivering of the placenta, or the afterbirth. The second stage is when the baby moves through the birth canal. The third stage is the placenta. Your textbook doesn't talk about any of the things that you can do with the placenta. There are organizations that will take the placenta and dehydrate it and turn it into capsules, and then a woman can eat those capsules, can swallow those capsules. What is interesting is that in the animal kingdom, the mother eats the placenta because it is so rich and so dense in nutrients, and it does sort of seem like a waste, right? A waste from the natural world sort of perspective. But our culture does not do that. We treat the placenta as some sort of medical waste, even though it would be dense. But there are organizations that will collect it and can turn it into some sort of resource that a woman can then re-ingest and sort of keep those nutrients. You can decide whatever you want about that. This is sort of another slide of other things I've kind of already talked about, but it's more systematically laid out. So when we are considering medical intervention in this process of childbirth, which again has been around forever, some things to consider is how we're going to manage pain. About 50% of hospital pregnancies or hospital births do something called an epidural. And an epidural is basically a pain blocker that goes in the spine, the base of the spine. I've had a couple of those. They're kind of scary. I think they're kind of scary. So I would encourage you to have a very, very well trained medical professional do this for you. This is considered what we call a regional oh my gosh, that word. Anyway, so it blocks the pain. And I believe there's one called a walking epidural, so it doesn't completely impair what you can do below the waistline. But these are very common. A natural childbirth doesn't have epidurals or pain blockers. And then what was going on when I was born back in the 70s was women were experiencing general anesthesia, and that's where basically they were like completely knocked out, and they went into labor and they were alert and they were knocked out with general anesthesia, and they came to and they had a baby. Not sure how you would push under those conditions, but that was the practice. So some considerations also is different ways. Most of the time you see women laying on their back, which from some perspectives makes not really very much sense at all, because it's not the way, like, you don't poop like that, you're not pushing it out. So you also can see like squatting on hands and knees, and then there's something called a birthing stool, which there's not a picture of it in the book and I didn't actually look it up. But laying is really not the most effective way because you don't have gravity. It's difficult to control. But if you've had an episiotomy and you've lost a lot of control over your legs, it's like the only way to do it. So these are things to think about and to consider when you are making these choices. A couple other considerations as far away from that natural childbirth is induction, or what we call the induction of labor. So if you hear somebody say they were induced, basically they were given chemicals, they were given drugs. Often it's Pitocin. I think that is the one, actually, and I believe Pitocin is a derivative of oxytocin, which we saw in a previous slide is what our body naturally produces in order to start contractions. And this is to sort of get things moving. I've not had a natural childbirth, so I cannot compare, but I have heard others say that labor that is induced is more painful than labor that is not induced. And this does kind of make sense to me, because when the body is naturally prepared, it would make sense that there would also be some natural painkillers. But when you just shock the system into going into labor, it can be kind of painful. There are some reasons to be induced. A baby is post-term. That's why I was induced. An infection. It's time to get this kid out of here. The baby's like done growing, got to get this baby out of here now. There's not enough amniotic fluid. And some of these are the same reasons why you might do a cesarean section. Cesarean sections are when they surgically open the uterus, the uterus, which can be crosswise or it can be up and down. Mine was crosswise. I had an induction or a cesarean like that. There are different reasons, some of the same for induction, but different reasons. The baby's in distress. There's no more room, the position of the baby, the health of the mother. In my case, my son had a condition called gastroschisis, and he had his intestines on the outside of his body. And so in the early 1990s, the standard practice was to take that child by cesarean section. Now, these babies actually go through the birth canal, but they didn't do that in the 1990s. In some cases, you might be induced and something doesn't, and it's not moving fast enough, and so you might have a cesarean section. I do not know why we would go up and down as opposed to sideways. My mother-in-law had a cesarean section that went up and down. For all I know, that's not even a practice anymore, but I didn't actually look at it. About 1 in 3 women have experienced, I believe it's 1 in 3 women have cesarean section. I don't remember what the textbook says. From my particular perspective on the way the world is, I think this is too much. I think it's good that we have these medical practices, but I sort of am still a little old school and think that wonder and believe in the mystery, the majesty of a woman's body. It's not an uncommon practice when there are multiples, when there are more than one. It is considered a major surgery. The recovery is longer. With a vaginal delivery, a woman would be encouraged to get up and walk around. Back in the 90s, you were still in the hospital for 30 days, right? Your baby was able to go home, but you may not be able to go home because it's pretty massive. And I think another reason to consider it, especially if this is your first time and there are no complications, like why am I being asked to do this? Is a phenomena called VBAC, and that stands for vaginal birth after cesarean section. There are some hospitals and some insurance companies that will not, regardless of how long it's been, allow you to deliver vaginally after you have had a cesarean section. And the argument is that because this is such a serious surgery, that the tissues, that it's weak, that the uterus is weak, and if you try to go, even if you go up to normal labor, so like in some cases, they won't even let you start laboring. It will put too much pressure and cause the uterus to rupture, which of course would be very bad. But I just think, this is my opinion, I'm not a medical doctor, but I do think I know a little bit about the way things work. I do think that a person should be ask a lot of questions. Ask a lot of questions and consider the full picture before we agree to have a cesarean section because it's just more convenient or it's what people do. Okay, I've gone over 10 minutes. It's 12 minutes and I will stop here. And in the next one, we'll talk about the conditions of the newborn.